get started. Cool. So my name is Beth. I'm a physical therapist. I'm currently doing the Neurologic residency, so I'm specializing in neuro through the University of Washington and Evergreen Health. And we're going to talk about rekindling the fire for lifelong physical activity. We're kind of at an interesting point right now. We've just experienced a pandemic. Physical activity has kind of had a lull for a lot of individuals. And so we're going to bring to light, again, some information you might already know, some more resources that are still present through the pandemic to talk about lifelong physical activity. Just as a disclaimer in general, this is educational content, not meant to substitute for medical advice, and of course, ask your healthcare professional before you do anything related to this content. Before I start, I want to acknowledge a few people. This wouldn't have been possible to make and put together without Alicia, Patty, and Micah. And then thanks to the Northwest Regional Spinal Cord Injury Summit System for hosting this. And also a lot of the content that I'm bringing up in this lecture or this talk is from the Northwest Regional Spinal Cord Injury website. And so hopefully it'll just bring back to light some of the resources that are already there. Objectives, we're going to go over the impact of the pandemic on people with spinal cord injury. We're going to go over insights into why, what, where, and how to start, restart, or maintain your physical activity. Discuss benefits of exercise, exercise recommendations, safety considerations. We'll go over something called the small steps ladder to increase physical activity. Then we'll review options and talk about some resources relating to physical activity in the home, at a gym, in the outdoors, wherever it may be. And we'll finish up talking about the role of the physical therapist in this. So the pandemic. The pandemic impacted people in many different ways, many different walks of life. There's research on the impact of the pandemic on people with spinal cord injury. And the research says that, understandably, there's been reduced activity in people with spinal cord injury through the pandemic, reduced quality of life for many different reasons, and increased injury, specifically pressure sores and shoulder injury, as well as falls. So we're in a moment right now where our momentum for physical activity, the resources we've had access to, have been in a lull for a few years. And while I'd love to say we're out of the pandemic, we're currently moving through it. So that's sort of the impetus behind this talk. Is we know that there's been decreased physical activity, decreased quality of life, and increased injury in people with spinal cord injury through the pandemic. Where do we go from here? So where to restart or start or maintain your activity? There's a lot of different ways you could go with this. It's going to be variable depending on your situation, but one good spot to start is determining your why. What's your foundation? What's the reason that you want to pursue physical activity? That's something that will help motivate you to get started, but also be the foundation that you're going to fall back on when things get hard. The motivation is going to be different for everybody, and the why will be different for everybody. This is a non-exhaustive list of different reasons why people with spinal cord injury have been involved in physical activity. Is your why going to be part of a community? Is it to increase independence? Is it going to be to promote recovery or prevent complications like pressure sore, shoulder injury? Is it to reduce pain? Maybe your why is to promote better sleep. Your why probably will span a multitude of reasons, but your why will also sort of guide what you're going to do. So if my why is to improve my mental health, then I'm probably going to choose something that I really enjoy. If my why is to socialize, I'll probably join some sort of team or be out in the community rather than my home. So something to start to guide you. Benefits of exercise can be a great why. So in the research, exercise has shown to improve these things on the left in people with spinal cord injury and prevent or decrease the risk of the things on the right. It's shown to improve muscle strength and ability to mobilize, so like your transfers, improve gut motility for bowel management, improve respiratory capacity or breathing ability, body composition, self-esteem and self-confidence, boost immune system function, and then on the other hand, it can prevent or decrease risk of anxiety, depression, pressure ulcers, respiratory infections, bone loss or osteoporosis, prevent onset of diabetes, decrease risk of heart disease, and colon cancer. This is not exhaustive, but this is what the research shows for exercise. Once you've thought through your why and figured out your why and your foundation to fall back on, or your motivator, then let's go into your what. What your exercise is going to be. This, again, is going to be probably different for everybody. But the exercise recommendations this is out of Canadian Spinal Cord Injury Association. The exercise recommendations are to work up to 3 times aerobic activity, 3 times a week, 30 minutes at a moderate to vigorous intensity. We'll go over intensity in the next slide. Starting at, for aerobic capacity, you could start at 2 times a week for 20 minutes, working up to and above 3 times a week for 30 minutes. Strength training, working up to and exceeding 2 times a week, 3 sets of 10 for each major muscle group, starting at sort of the same dose, but maybe a little bit less intensity. So the goal is to start on the left here, work through, move up to the right, meet these sort of minimums if you can, and then exceed from there. So what does it mean to work out at a moderate or vigorous intensity for aerobic exercise? So this is a rate of perceived exertion scale. On the right, you see your percentage of heart rate max. So many individuals will use percentage of their heart rate max for how hard they're working. However, with spinal cord injury, you may have blunted heart rate response, altered resting heart rate. So heart rate tends to be a little bit harder of a measure to be managing and monitoring your exercise. And an equivalent is the second sort of line here is effort. And the third is description, which often brings up like the talk test. So moderate intensity here, this is a 6 to 20 scale. Moderate intensity would be from 12 to 14, which is the somewhat hard level. So if I'm working somewhat hard, my talk test, how easily I can talk, would be slight breathlessness, but you can still talk. What you might feel is increased sweating. You can still hold a conversation, but it would be difficult to continue a conversation for very long. So you're working somewhat hard. That's how I feel, my rate of my perceived exertion. My talk test is slightly breathless. And then the equivalent would be, that would mean you might be working at 70% of your heart rate max in that moderate intensity. When it comes to vigorous intensity, that is the 15 to 17 or 18 on this scale of 6 to 20 here. That would be considered your hard or your very hard exertion. So if I'm working and I'm trying to figure out, man, how hard am I working? If I think this feels hard or this feels very hard, and then also I go over to this description here, I'm sweating, I'm still able to push and maintain proper form and keep a fast pace, but I might not be able to keep it for very long because I'm working in that hard to very hard range. So this is one tool, rate of perceived exertion, and the talk test that you can use because monitoring your heart rate and your percentage of your max heart rate might not be as equivalent if you have a blunted heart rate response with spinal cord injury or an altered resting heart rate. So strength training, the recommendation was to work your major muscle groups. What does that mean? The Northwest Regional Spinal Cord Injury Association has a nice PDF on upper extremity major muscle groups and why it's important to work them and how to work them. So I've pulled this from that. There's a link at the end of my session that references that if you're interested. So the shoulder depressors is an important muscle group that helps with transfers and pressure releases. That's your lats, that's here. Shoulder depression is pushing down. So you can imagine pushing down like a pressure release. Pressure relief is those shoulder depressors. If I want to be able to transfer or do shoulder depression and pressure reliefs for a long time, then maybe I want to work my lats. So that might look like, I've put up a few examples. It's non-exhaustive, and there's photos on the PDF online. That might look like a lat pull down, where I'm pulling a bar or a TheraBand down, working my lats here. Maybe that's a chair push-up, or what you might be doing for pressure reliefs. When it comes to triceps, the muscles behind your elbow that extend or straighten your elbow, those are important for helping with transfers, pressure reliefs, locking your elbow to pivot off of your elbow, for bed mobility. A few ways to work those would be like an overhead dumbbell. I have a dumbbell in my hand and I'm pushing it up like this. Maybe a pull down of a rope or a TheraBand, or a tricep dip where I'm pressing up and dipping, similar to a pressure relief. Next one on the list here is shoulder external rotators, which are really important for stabilization of your shoulders. External rotation is this movement where I'm rotating my shoulders out, stabilizing my shoulders. Very important in spinal cord injury for preventing pain and overuse. So maybe that's going to look like a TheraBand here, and I'm rotating and pulling out, or a cable, and I'm rotating here, or I'm laying in bed, and I'm trying to lift and rotate. I'm laying on my side. Shoulder extensors bring your arms backwards, muscles back and behind your shoulders, which are important for manual wheelchair propulsion. Cable rows, so when I say cable, I mean like a cable machine at the gym, or a TheraBand connected to a door, connected to something. Rows would be pulling back. I'm extending or bringing my shoulders back. A face pull, which might be more up at my face, where I'm pulling back. Or you're bending over in a chair and you're doing flies, which would be bringing your arms back with a dumbbell. These are just really fast examples, so if you're interested, I encourage you to look through the PDF that I'll go over next. And then scapular retractors. So that's scapula, shoulder blade, and those are the muscles that squeeze your shoulder blades together. Important for posture and any pulling motion that you might be doing. Exercises there would be a shoulder blade squeeze, where you're squeezing your shoulder blades together and holding it there, or again, a cable row, or something where you're pulling a TheraBand back. I saw a question in the back. The question was, with TheraBands, do people have less spasms than like a weight or something heavier? It definitely depends on the person. I think a TheraBand is a really good place to start because you can modulate them, where if you're holding closer and it's too much and you're efforting so hard that you're spasming or having increased tone, then you can hold further back or farther apart and go slower to sort of help manage tone and spasms. So I haven't necessarily noticed that it's the TheraBand itself, but it's the speed of the motion and the effort of the motion that might alter the spasm response or the tone. And it's easier to modulate a little bit with the band over a set of dumbbells, where maybe you're going from 1 pound to 2 pound, but you could have something like 1.5 pounds equivalent in a TheraBand. Did that answer your question? Okay.
Can I just add a personal tidbit?
Yes, please. Yeah. Yeah. The response was that TheraBands are easier to use than some dumbbells. I have a question. Do you feel like you get enough resistance with the TheraBand? Have you hit, like, do you notice a difference between a cable or a band or a dumbbell? That's a perfect answer. Someone said that you can get really varied bands. Like, you can get some really resistant ones. That's actually one of the reasons I was curious, because I think a lot of people run into not feeling like they get enough resistance with TheraBands, which is just a brand name of bands. And if they look into some of the thicker tubing, they can get a lot more resistance. The tubes tend to be heavier and have a little bit more resistance. So yeah, and I think that's usually where I'll guide someone who feels like the TheraBands aren't giving them what they want. The tubes have handles. So thank you for saying that. That was helpful. So this is a link to that, or a link to the website that has the PDF that I was referencing that goes through important upper extremity muscle groups, and maybe how to work that with a band, with a dumbbell, and talks you through how to do it. So when it comes to stretching, earlier we talked about the recommendations for aerobic capacity and the recommendations for strength training. There's also the recommendation for stretching is to do stretching daily, 2 sets of 30 to 60 seconds per stretch in a slow, gentle, and pain-free way. This is going to help allow you to maintain your flexibility for things like posture, balance, activities of daily living. Maybe you need to be able to get into long sit where your legs are straight in bed and your trunk is up so that you can do your bed mobility. Well, if that's in your wheelhouse and you need to do bed mobility like that, you need to make sure your legs are still flexible enough to get straight. So stretching, different regions are going to be important for different people. One place to start is just to focus on the muscles that are shortened in the position that you spend your most time. So what does that mean? If I spend the most time in a seated position, then my hamstrings, which are back behind my thigh, are shortened, and my hip flexor, which is in front of my hip, is shortened. And so I probably should focus on stretching my hip flexor and my hamstring, straightening out the hip, straightening out the leg in whatever manner that you need to do, because those are the muscles that are shortened in the position I spend most of my day in. That's just an example of where to start. Lots of different ways to stretch. Yoga, laying on your stomach, standing frames, if that's in your wheelhouse, using exercise bands. Again, the Northwest Regional Spinal Cord Injury System has these PDFs. I think they have 5 or 6 that go through different stretching programs. They have self-stretching, they have assisted stretching for a variety of different body regions and abilities. So that's another really good resource. If you don't know exactly where to start with stretching, or you need to come back to, am I doing it right? It's a good resource. So safety considerations for exercise in people with spinal cord injury. Autonomic dysreflexia is a safety consideration if you have an injury T6 and above. Autonomic dysreflexia is an emergency. It's a cause to stop at what you're doing. It's something I'd encourage you to talk to your doctor about if you haven't already. One sort of tip or trick to manage autonomic dysreflexia with exercise is emptying your urine bag prior to exercise so that it doesn't get blocked or back up. Skin breakdown is important to think about, important to monitor your skin, use padding with equipment, perform frequent weight shifts. You may or may not sweat below the level of your injury. You may or may not have sensation below the level of your injury. And so if we have sweating or increased heat in our body, our skin is a little bit more likely to break down because of moisture. So something to keep in mind. Fractures is another thing to keep in mind. If you have not stood in more than a year, it's important to get doctor clearance before doing weight bearing or standing exercises. Blunted heart rate response, like I talked about before, that is a cause for using rate of perceived exertion to monitor your exercise, or the talk test. because it might not be effective to use your heart rate response or be watching your heart rate to understand how hard you're working. Post-exercise hypotension is a drop in blood pressure after exercise. If you don't have contraction of muscles in your body, then your circulation is altered. And when you're exercising, it puts you at risk of blood pressure dropping after exercise. So it's important to consider having a warm up and cool down period so that you can optimize your circulation and not go from full on exercise to no exercise. So your body has a little bit of a cool down buffer. And then lastly, temperature regulation. You may or may not have sensation. You may or may not have a altered sympathetic response, so that fight or flight response in response to exercise. And you may not be able to sweat. So all three things that would alter your ability to regulate your temperature when you exercise. A couple things to think about are just to exercise or move around in cool environments, using cooling techniques like ice on the back of your neck or wearing really light clothing. Yeah. Yeah, the question was if someone's legs don't sweat, how does that impact their skin breakdown? And actually, you're more at risk for skin breakdown when it's moist. So if you were sweating, you'd be at more risk. And so less sweating doesn't make you at more risk. But maybe you're sweating above the level of your injury and the sweat goes down to your legs and you can't feel it. Still a little bit more moisture. But yeah, you're right. Not sweating, less moisture, and it's a good thing, yes. Still something to keep in mind, though. Okay, so summary, exercise recommendations are for heart health, minimum 2 days a week of moderate to vigorous aerobic exercise, something that's getting your heart rate up 20 to 30 minutes per session. For muscle strength, minimum 2 days a week, 8 to 10 repetitions, 3 sets, a little bit, 1 to 2 minutes of rest in between. And then for flexibility, the recommendation is to be doing daily stretching, 30 to 60 seconds, slow, gentle, pain-free stretching, 2 sets of 30 to 60 seconds, which the time frame here, I think, is going to be wildly variable, how long that takes you to get those done. So don't get too caught up on the 5 to 15 minutes. That's just a guess on how long that may take somebody. Okay, so we've gone over our why and our what. Now we'll go into how. How is going to be very, very variable. But the University of British Columbia has what they call the small steps ladder for people with spinal cord injury, which is just a foundation or a framework, rather, to look at exercise as a big spectrum. So exercise doesn't have to be what you would consider as exercise. Exercise can just be increasing your daily activity, increasing things that you're doing every day, which would be this everyday active sort of exercise, because you're still burning calories, you're still getting your heart rate up. If it's taking you 20 to 30 minutes to propel your chair because you parked further away than you would have, then you got in your exercise. It's just more of a daily activity type exercise. Then on the next rung is the accessible activities, which is something that's maybe people are thinking of as more of exercise, going to the gym. And above that, which is not necessarily better, is adapted sports. So it's just a framework to think about small steps towards moving through different ways to exercise without having to get caught up on the idea that you need to go to the gym immediately and be a power lifter to say that you exercise and get in these recommended numbers. So everyday active, the examples of the everyday active activities are running errands, parking further away from the grocery store so that you're wheeling further or walking further, standing, playing with your kids, taking your dog out for a walk or roll, things that you're able to work into your routine, basically. Maybe it's a little bit more intentional, specific, smaller exercises, not necessarily a functional movement. Maybe it's sitting at the TV or computer, squeezing objects for grip, doing bicep curls while you're dual tasking by being on the computer or watching TV. Then you would go into the accessible activities rung, which is maybe something that's a little bit more higher intensity, not necessarily better, but probably because it's higher intensity, getting a little bit more health benefits, but you don't have to have the commitment of team sports where you have a team. This would be like going to the gym, doing the arm bike, wheeling for fun, wheeling for endurance, standing frame exercises, dancing. It can be anything really. Strengthening activities would be resistance bands, lifting weights, Pilates, yoga, Tai Chi. And then moving into the adaptive sports realm. Adaptive sports can be low cost or high cost. I've tried to sort of separate them here a little bit. But maybe you need the fun component or the accountability component or the teamwork component. Or maybe you need to see that you can do something that you previously thought was impossible, or you need the community component. Then this sort of adaptive sports route or adaptive exercises route, team sports route might be the one for you. This framework is really just a way to think about small steps. You don't have to move to the top of the rung to get your recommended exercise done. Motivation is sort of the crux of it. In speaking with some of my friends with spinal cord injury, they will frequently talk about how motivation is sort of the most important part for them. It's important for everybody, but they've given me the feedback that their intrinsic motivation, like their ability to believe that they can do something, is what got them going. And nowadays, we can get that ability to believe that I can do it by looking up things on Instagram, looking up things on YouTube of someone maybe with a similar injury, similar age, or similar activity that you want to do, and just boosting your intrinsic motivation to see other people doing it, because seeing other people doing it is incredibly important for our own self-belief and self-esteem that we can get it done. And then on the other side, extrinsic motivation. Who do you need of your support team? Do you need a personal trainer? Do you need friends to go with you or friends to keep you accountable? Do you need your family to ask you how it went or to listen to you, to talk about how it was hard or what didn't go well? Who do you need on your support team to extrinsically motivate you? Everyone is going to be very different in this realm, but as you get started or as you're trying to maintain your activity, thinking through what are the things that motivate me intrinsically and what do I need in terms of extrinsic motivation to make this sort of a lifelong thing, because at some point it'll get hard and we can fall back on our motivators. Okay, then determining your where. Is it going to be in my home? Is it going to be at the gym? Is it going to be outdoors? Is it going to be all of them? What's the accessibility I need to get to these places? What's realistic for right now? Do I need it to be in my home because I don't have a way to get to the gym? But once I start in my home, maybe my goal will be the gym. Your where is going to be dependent on your situation. But my goal with this part, the where part of this, will be just to talk over some resources that are out there, for resources at home, resources in the gym, and resources in the community or the outdoors. One resource is if you're interested in home-based groups, there's an SCI Total Fitness webpage that does these every body fitness. They're home-based exercise classes. They have them live, they have them recorded. There's also the Mount Sinai spinal cord injury weekly virtual classes. Thanks to COVID and the pandemic, we have a little bit more in terms of virtual activities, which is really helpful for accessibility. And so this Mount Sinai, SCI.org, has boxing classes, peer support, meditation groups, that you can look into. Or are you more of a home-based exercise video or exercise guide person? There is at washington.edu is what I've been referencing, where you can find the SCI home exercise packets, the stretching, the strength training. They have one on things to do at the gym. Or another good resource is the Miami Project. They have a nice at-home fitness guide. It's a PDF version, not a video guide, but PDF walks you through exercises to do or how to do them. If you're more of a video person, YouTube is a good spot. You can find a plethora of things on YouTube. Or also the National Center on Health, Physical Activity, and Disability, NCPAD, has something called the 14 Weeks to a Healthier You, which is a little bit more tailored to, you can put in what your injury level is or what your ability level is, and you get weekly videos and motivational videos to do. So I really like the NCPAD 14 Weeks to a Healthier You. Okay, cool. Equipment for home, like we've actually already mentioned, the tubing can have grips or handles. It can be nice to have TheraBand or tubing that you can connect to your door. Another thing you can do is tie TheraBand into a knot and then close your door, and that knot holds it in place, so you effectively have the same thing as this woman on the right is using, but just with the door closed. Ankle weights can be nice to strap around your wrists so that you don't have to hold on to something. If you would rather pull on something and you don't have hand function, there's wrist cuffs, or you can use an elbow strap, or you can just use dumbbells. When it comes to gym exercise, at a more standard gym, there is usually a cable machine, which is this one on the top right, where you don't have to transfer out of your chair. You can set it up in a variety of different ways with a variety of different attachments and stay in your chair without having to transfer. If you do transfer, like this female in the bottom left, figuring out which items can you transfer onto successfully, or how do you need to alter it. Some gyms will have swing away chairs or turning chairs that make it easier to transfer and not quite as cramped as this bottom left video here. Again, the washington.edu has a gym exercise PDF that you can go through that gives examples of what to do with free weights or exercise equipment at the gym. This is what's in the top left photo here. And then it doesn't have to be a more standard gym. You can go to a Pilates gym. This bottom photo is Pilates Reformer, which is something that you're laying down, getting resistance exercise on. You can do arm exercises and leg exercises in a laying down position. When it comes to cardio, multiple different options at the gym. Some individuals I know really like the battle ropes, which is in this top middle photo, or a rope pull at the gym. They don't have to transfer out of their chair, and they can use the ropes to get aerobic exercise in. Punching bags, medicine ball. Doing medicine ball exercises is aerobic still if you're lifting at a faster speed. Or more specialty equipment like the arm bike here. Many YMCAs will have a new step, which is a sitting down elliptical. Basically, you can use your arms only or arms and legs. And then this middle photo is more specialty equipment. It's someone in a wheelchair treadmill. The specialty equipment is something you'd find at an adaptive gym like Pushing Boundaries in Redmond, and might not find at your standard gym, but it's worthwhile calling and asking. Talking about specialty equipment, in the bottom photo with the female in blue, that is someone on a MotoMed, which is a type of bike that can move passively. You don't have to put any leg motion into it. It can also detect spasms and work through spasms. She also happens to be on functional electrical stimulation, or FES, which is a way that electrodes connected to your muscles can contract your muscles and allow your muscles to be pushing the bike. On the far right is the VitaGlide, which you're moving your arms like this. You're getting a little bit more lats and shoulder motions or shoulder strength than you do with a normal arm bike. The VitaGlide and the MotoMed and the FES are also something you'd probably only find at a specialty gym like Pushing Boundaries or at a therapy clinic. There's Pushing Boundaries in Redmond. Was there a question in the back? Yeah. The question was, what is the device that the person is on in the female in the blue is on, and then with FES, functional electrical stimulation, do you notice less muscle atrophy? So she's on the MotoMed. Not all MotoMeds have functional electrical stimulation, and you don't have to use a MotoMed to use functional electrical stimulation. But yes, one of the major benefits is decreased muscle atrophy because it's stimulating the muscle to contract when the spinal cord might not be able to effectively stimulate the muscle to contract. There's a variety of benefits from FES. That is one of them. And then for hand grip, there are active hands. The sort of middle photo is something that you can have strap the equipment onto your hand, like a dumbbell, or I like to use it on a cable pulley machine where you strap the cable pulley onto your hand and then you can take the cable off and connect that same hand piece to a different machine or a different pulley aspect without having to unstrap. It's also a way, without hand function, not to worry about dropping dumbbells. There's this PRC in the top left where it's just a hook, so a little bit less cumbersome with having to strap on and off, but you need a little bit more control to not lose the item out of the hook. And then if you don't have that specialty equipment, you can use, in this middle photo, like an ACE wrap or tube grip, wrapping your hands onto. He's on a arm bike. And then Body Point is one brand that makes trunk straps. So if you'd like to be focusing on your arm strength and not have to focus on your trunk stability, you can use a strap on any exercise equipment. This strap just comes with you, and there's a variety of different widths based on what you need. There's straps from many different companies. I'm just most easily able to find the ones from Body Point. Gym accessibility can be hard. Because of that, there's two good articles, two good resources out of washington.edu and NICPAD. The washington.edu resource has this left-sided accessibility checklist and a couple other sort of recommendations. But one thing that one of my friends will always ask is, and be successful with, is do you give discounts? If I'm only going to use 30% of your gym equipment, then can I have a discount? And she's been successful every time. So obviously it depends on the gym, but worthwhile asking. And then, do you have anyone who's certified or specialized or ready to help someone with a disability, whether it's for transfers or do they have a personal trainer that has a certification, etc.? It's worthwhile asking. And then this other chart here comes out of the NICPAD. Using a fitness center doesn't have to be an exercise and frustration article, which is a great article that has a whole list of barriers to getting to gym access, simple, low-cost solutions to offer the gym, and then the more involved, high-cost solutions to ask the gym for. And it goes pretty in-depth in, okay, if the spaces between the equipment are too narrow, the simple one would be to ask the staff to move the equipment. The more involved one would be to ask the facility to follow ADA and move the equipment to 36 inches of clear floor space. And so if you're having a gym accessibility issue, it's likely that it's in this chart, and there's options that people have been successful with in the past. So a really good resource there. When it comes to personal trainers, there's actually certifications. Depends on the company through which the personal trainer got certified through, but if they got certified through the ACSM, there's a certification called the Certified Inclusive Fitness Trainer. If they got certified through the NSCA, there's a certification called Certified Special Population Specialist. And those individuals are going to be certified and ready to help people with disabilities and have a little bit more fine-tuned knowledge if that's something you're interested in. There are directories to find these type of personal trainers. The ACSM has a directory, and the NCPAD, National Center of Health, Physical Activity and Disability, has a directory to find people with these certifications in your area. And then I'm sure there's more certifications for different exercises, but Pilates, I know, has a certification called the Post-Rehab Conditioning Specialist, who would be another person with a certification to help out. Cool. So outdoors. We live in the Pacific Northwest. The outdoors are amazing. We also are lucky enough to live in an area that has more resources and organizations for people with disabilities than many other areas. So this is a really small list of a ton of different organizations. But if you have an activity that you're interested in, I'd encourage you to Google if this area has an adaptive organization for that activity. One that I really like is Outdoors for All. They've got skiing, snowboarding, snowshoeing, cycling, kayaking, hiking, climbing, yoga. They, out of Magnuson Park, have a really large fleet of adaptive cycles and run a pretty good adaptive cycling program out of Magnuson Park. So I could spend hours and hours going over all the organizations, but if there's something you're interested in doing and are wondering if there's an adaptive version, I'd encourage you to Google it, because there are a lot of organizations in our area. Another nice thing in our area, so TrailLink and Washington Trail Association, WTA, both have accessibility features on their websites to find trails that are accessible and outline how accessible or what the accessibility needs are at that trail. Actually, yesterday, the Seattle Times came out with an article on the best accessible trails in our area, which is really exciting. It's a really good article. So look, I don't know the title of it, but it came out yesterday, and it's on accessible trails on the Seattle Times, so it shouldn't be too hard to find. And then if you didn't already know, the national parks have something called the Access Pass, which if someone has a permanent disability, they can get an access pass to get into national parks for free forever. You can go to the National Parks website and look at Access Pass, and you need one time a doctor's note saying that you have a permanent disability, and it doesn't matter what the disability is, and then you have the Access Pass forever. Cool. So the role of the PT. If you're a PT, I encourage you to look at the Proactive SCI Toolkit. It's out of the University of British Columbia, and it's a pretty good exhaustive PDF on how to guide and promote support people who are trying to get into physical activity with spinal cord injury. PTs are a really good resource to help out, whether you're working with PT right now, have worked with PT in the past, or don't have a PT. I encourage you to ask your PT or seek out a PT if you have questions specific to developing your training. What are my specific training needs, or do I have specific limitations or guidelines? PT should know your doctor's vital sign guidelines or weight-bearing guidelines. PT is going to be obviously I'm biased because I'm a PT, but They can be a really good resource for helping train caregivers or personal trainers, communicating with your personal trainer about specific needs, or this is what we've been working on in PT, or these are medical guidelines that we're trying to be cautious of. I encourage you not to be shy about reaching out to your PT, even if it's not a specific PT-related question. If it's related to exercise and you're trying to figure out what your training needs are, reach out. Cool. So this is the last slide. This is the START plan, which is from a previous article out of UW's spinal cord injury system. It's the START plan. So I want to take just a couple minutes because all of this is going to be unique to you. Work through this START plan, thinking about what is your schedule, where does it need to fit into your day, or how long do you have, your timing, is this the right time in life to do something related to changing towards physical activity? Is it, what activity do I want to do? What resources do I need, or what resources do I have? And how am I going to keep track of this activity? So take a couple minutes just to think through, brainstorm a couple things relating to the START plan, and then we'll go into questions. We'll just take 30 seconds. Yes, Jeannie? So the question was, when exactly do you need to ask your doctor or see your doctor if you're going to start an exercise? I think there's a lot of different answers to that. One that comes to mind would be if you're drastically changing something that you do and you haven't done it for a very long time. So if I don't usually get my heart rate up and I want to go to the gym and do battle ropes for 10 minutes or something, and that's a big change, and I haven't tested my circulation in quite a while, that's one that comes to mind. Is if it seems like a drastic change or demand on your body, and you want to go from not doing it to full on doing it, that's a good time to ask for doctor recommendation. I think that if it's something where you're nervous about your body's ability to withstand the intensity, so if I am hoping to do more standing frame activity, but I don't know if my bone density is good enough, and I haven't stood in, the recommendation is always if you haven't stood in a year to see your doctor, but let's say it's kind of on the border and it's been 7 months and I'm just not quite sure or have a question about my body's ability to withstand the intensity. I think a lot of it has to do with intensity and your body's ability. Or if you have some red flags like, well, when I tried to do a stretching exercise and it really hurt, and I'm not really sure why, and it doesn't seem like when I tried that 6 or 7 months ago, it doesn't seem like it hurt. If you try to take those small steps into something and something seeming off, that's another time. It's hard to answer that exhaustively, but my gut says if it's a big change in intensity, if you're curious about your body's ability to withstand what you're doing, or you've tried and something's off, then that's those are definite times to go talk to your doctor. Good question. It doesn't have to be a question. It can be a comment or something that you've been experiencing through activity in the pandemic. Or yeah, the question was about how aqua therapy impacts risk of pressure sores or skin breakdown. Yeah, it does increase your risk of skin breakdown if you're wet and do a transfer and you shear, because moist skin and skin that's been in water for a long time, as we know, kind of can get thin, and that is one of the things to be mindful about with aquatherapy. Aquatherapy has a lot of other pros, but one of the things to be mindful about is, you're exactly right, it increases your risk for skin breakdown, but not just because you're in the water. It's the added skin's moist and then something else on top of it, like a transfer where I shear, or hitting my skin on something while it's moist. So it's important to, afterwards, just really make sure you're dry. That's out of physical therapy scope, but I don't know the best drying mechanisms, but I like the idea. Yeah. Yeah, exactly. Aquatherapy exercise in a pool is very beneficial. It's a really good modality for exercise. It's also a more approachable modality too, where it can be not as hard to move your body in water. So while getting to a pool that's accessible is less approachable, moving your body in water is more approachable. Yeah. Awesome. Someone was just mentioning the Bus One Foundation, which is a foundation that supports people, funding for people, is that correct, to take transportation out to do the things that they want to do, get out into the community and exercise and things like that. Relating to a pool, that's one of the gym accessibility questions here, I'll skip to this, but that's one of the gym accessibility questions on Washington.edu's questions to ask is, if you have a pool, what are the ways to get in and out? Do you have a lift system? Do you have assistants or techs? And what does that look like? What's the temperature of the pool? Is it a warmer pool where I'll have to think about temperature regulation, but I'll have warmer temperature for easier movement? Those are a few of the questions in the gym accessibility article from Washington.edu. Yeah. Restorative Technologies is another FES spike vendor.
That was the one I was looking at. It's 36 with a 12-week wait for 6 weeks.
Mm-hmm.
I'm just trying to make sure that if we're going to do that, I have a wait of 6 weeks.
Yeah. But you're exactly right. It has to be consistently done. Similar to most things with exercise, we don't have the benefits. Yeah, we don't have the benefits for long term. Yeah. Everything that you're saying makes me so excited. I could nerd out about that forever. All right, well, thanks for staying at the last session. If you have any questions, let me know, but thanks so much.